from a hygiene standpoint, I like to do is really about case acceptance. I do a little thing I call the total care interview, which is a process of educating patients in comprehensive dental needs and wants. It's a basic 5-step process. Now, when you think about what makes a patient say yes to dentistry, is it more about the knowledge you possess to the patient or the relationship you have with them? Relationship. Now, in general, men and women better at relationships. Listening, multitasking, attention to detail, caring. Guys, why do we let you talk? Right? So for the female dentist in the room, as a general, any female dentist in the room, as a general, you're going to be better at case acceptance just because of your natural tendencies than some of your male counterparts. But the ladies in the room, which are typically male hygienists, okay, we got those once in a while. Generally speaking, the females in the room are going to build a better relationship with the patient, which is going to build trust, rapport, and relationships. So I like to utilize the hygienist and the staff for that reason. So when I'm in the chair as a hygienist, first thing I'm going to do is make a general conversation. I'm going to ask about how's your family, your kids, how's Logan and Kylie doing? Is Logan still doing karate? Is Kylie still into singing? And I'm building a little trust, rapport, and relationship. I want to care about the patient, not just the teeth. One of my good doctors down in Charleston tells me all the time, Kelly, you got to remember that there's a patient attached to those teeth, and it's all about relationship. So once I've talked a little bit about the kids or the family or whatever's going on in the job and so forth, so the first step is what I call the introduction. It's really about making the patient feel comfortable and at ease. And if I don't do that, if I don't transition them from coming in and all the frustrations and things that they've got going on in the outside world to making them feel comfortable, they are not going to listen. If they don't listen, they can't understand. If they don't understand, they're not going to say yes to the work. Step 2, once I've done the nicey-nice, I'm going to do what I call the general questions, where I'm going to start off with, do you mind if I ask you a few questions? I'm going to get permission. I'm going to ask about health history, any medications and prescriptions, everything up to date. And then any basic changes in your health history in relationship to that. And then I'm going to start to find out what are their needs and what are their wants. Now, 99% of their needs can be found by asking just 5 questions. What are the 5 questions that will identify 95% of the needs? What are they? Are they having sensitivity to hot, cold, sweets, pressure, or other concerns? Still get a name. Okay? You got it. You bet it. Okay? Now, here's what I don't want you to do. It's a question, not a statement. Here's what I see all the time from hygienists. Barbara, you're not having any problems like hot, cold, sweets, pressure, nothing like that, are you? Good. See, because mentally, you don't want your patient to have a problem, but in fact, the doctor's like, I hope they have a broken tooth. And so you kind of wish it right on, but it's not what you mean to do. Now, the other thing that you do is you get this little run-on going here, because, Dr. Blair just gave me 15 minutes. Hey, I had an hour yesterday. So I got to get this through. And so it's not a mentality of get them in and get them out. It's a mentality of get them in and get them back. So I've got to ask Barbara, are you having sensitivity to hot? How about cold? Sweets? Pressure when you bite or chew? Okay, what do you maybe mean? Okay? Now, what I hear a lot of times is if I ask, do you mind who's the hygienist? Okay, I want you to ask me those same questions. Hot, cold, sweet, pressure, or other concerns. We already did the nice and nice. Okay, I want to show you how quickly sometimes people don't listen. Okay, do you mind if I embarrass you? Okay, so ask me about hot, cold, sweets, and pressure, and I'm going to answer, and you tell me where we go from there. Not really. No. Not really. No. What'd you miss? Yeah, see, I said not really. She heard no and kept on going. Right? So she heard no. What does not really mean?
Yes.
It means I don't want you to take any of my money. I'm telling you no. It's like hide and seek. Yeah. If I say yes, we're done. I'm like, you're going to sell me something. So when a patient says not really, I would ask, what do you mean by not really? Is it this? Is it this? Is it that? Is it there you go. Which goes into step 3, which is called the magnification question. Step 3, which tooth is it? Is it shooting pain, driving pain? How intense is it? What does not really mean? I have to find that out. Now, since you've got this problem, you mind if I take the intraoral camera? So now, also on my iPad, anybody here have one? Or using them now? Using them now? I just click over here to my photos, okay? And I could have a couple different libraries, okay? So I can have my cracked teeth, my missing teeth, my failing broken teeth, whatever I want to have here, I'm going to jump over to one, just pick one here. This is what I call, okay. So I got, see this, pretend it's the intraoral camera, but I have it on my iPad. You see this tooth with this large filling? That big old chunk right there, that might be what's causing the problem, okay? Now, someone says, well, I don't want to do that Mr. Tooth because, it's not really bothering me. Yeah, it wasn't bothering this guy either, but see what can happen over time if you do nothing. See that? That's my $1 million show. 3 was the magnification. So I want to use the intraoral camera, which uses shooting pain, driving pain, anything getting worse, better. And again, with the interview, the more questions, the better the interview. Okay? So now we find out what's going on. She's having sensitivity hot, lower left-hand side, 1 to 10 scale. It's a 6. It's been keeping her up a little bit at night. Now the number 4, this is the question that most people avoid because this is where the rubber meets the road and we could have conflict, is what I call the if question. I know this might sound silly, Barbara, but if we could prevent it from getting worse, breaking or fracturing, would you like the doctor to do something about it? Well, yeah, you idiot. Why do you think I'm here? Well, you'd be surprised how many people will get the doctor's advice and don't schedule, but I'm glad you're not one of those. Okay? How many times they say no? Okay? Now, you don't have to be that forward. I know, Barbara, this might sound like a silly question, but if the doctor could prevent it from breaking, fracturing, getting worse, if the doctor would save you time, money, and discomfort, would you like him or her to? Barbara says yes, but what is it going to cost? Well, I know this, Barbara. Doing nothing costs more. But I'm going to take you up front and introduce you to Barbara, who's our financial expert, which she is. And Barbara has payment plans that fit almost anyone's budget. Hear that? We have payment plans that fit almost anyone's budget. Now, before the doctor walks in, what did I just give my patient? Hope that she can do the work, right? So I'm encouraging her. So now she can start to listen, because if I don't give her that hope, she's thinking how much it's going to cost, how much it's going to cost, how much it's going to cost, how much it's going to cost. The doctor comes in and says, what do you need? And the whole time Barbara's thinking, how much it's going to cost, how much it's going to cost, how much it's going to cost. She never heard what the doctor said. Then he come up front and say, Barbara needs a crown. She goes, I need a what? She didn't hear it, okay? So I find out if she wants to. If she doesn't, I find out why. If she does, yes, I'd be interested in saving it. Well, here's what I think the doctor's going to recommend. I think Dr. Watson's going to recommend a filling, a crown, a root canal, but we're going to check with him or her. They are the experts. Okay? We're going to check them. They're the expert. When Doc walks in, I'm going to say, Dr. Blair, this is Barbara, and he's good at this one. He's going to do the, okay? So Dr. Blair comes in, I say to Barbara, this is Dr. Blair. Dr. Blair, Barbara and I were just talking about her underwater basket weaving class that she was taking, and she medaled in college just like you did in underwater basket weaving, so you guys have that in common. Now, Barbara hasn't had any change in her health history, but she is having sensitivity to hot on the lower right, and that's a 1 to 10 scale. You said it was a 5, kind of a 6, and I've taken a picture of the intraoral camera. Now, I didn't forget, I was reeling her in, right? Okay. So, Barbara has that rather large filling, and I've told her, or I've asked Barbara if she'd like to prevent it from breaking, fracturing, getting worse. She said yes, but wanted to know what it's going to cost. I told her to take her in front to Elsa, see if we could work it out. So Barbara wanted to see what she thought. I told her I thought it would need a filling or a crown, but wanted to check with you. I've taken the shade on Barbara. She's a B1. All good there. Doesn't want to change. Also, all her probing depths with perio. Good shape. Everything's less than a 3. Got one little area she's going to work on floss a little better, but other than that, Dr. Blair, she's in pretty good shape. Barbara, did I leave anything out? Okay, so Dr. Blair, I think she needs a crown on the lower right-hand side, but why don't you take a look and see what you thought?
Yeah, I took a look at it, and yeah, it could need a crown. It could, I don't know.
You gonna watch that, Dr. Blair? Now, Dr. Blair, not to be rude in front of a patient, but Dr. Blair, do you mind if I ask you a few questions?
Yeah, go ahead.
Dr. Blair, Barbara's a friend of mine, and I just want to ask on Barbara's behalf. Typically, when you're watching Dr. Blair, you watch it get better or worse?
Typically, dentistry, they don't really get better.
Yeah, okay. And so if it gets worse, is there a chance it could break or fracture?
Okay,
Okay, and if it breaks or fractures, then perhaps Barbara could be in pain.
she could.
Could you always save her tooth? You can always save it if it breaks? Oh, good. And if it does break or fractures, it could cost Barbara more or less? Okay, and so we're doing Barbara a favor by watching why?
Maybe you need to do it.
Yeah, okay. So, Dr. Blair, I've done this a time or two, but one thing you want to make sure is a hygienist. What does your doctor feel? Is it something that's needed and wanted versus what are we watching for. So but really, if you're a preventative practice, it's not about watching and waiting until it gets worse. It's really about prevention. So really, if Dr. Blair came in, he'd say, yep, I agree with Kelly, it probably does need a crown. If you want to prevent it from breaking fracture getting worse, if you want to save that tooth, and I would like to see it no later than 2 weeks. And again, I want to know how far out I'm booked, which I coordinate with the scheduling manager in my morning huddles. And so Dr. Blair knows already that I've got openings in 2 weeks or 1, depending on what it is. Dr. Blair is going to say, I'd like to see you, Barbara, no later than 2 weeks, if you want to give it the best chance of saving the tooth. Now, one other thing on that little side note is you want to talk to patients about what they want, not tell them what they need. When you tell someone what they need, you get the instant, no, I don't, push you back. But if I ask you, do you want to save the tooth? Do you want to prevent it from breaking? Do you want to save time, money, and discomfort? Do you want the best dentistry we have to offer? Do you want us to help you find a financial way to get it done? Patients will say yes to wants all day long. Tell them to do anything.